All right, so here we have a 26-year-old archaeologist presents with fever, cough, and malaise after working in a desert region of the southwestern United States. Laboratory studies show mild eosinophilia. Culture of respiratory secretions reveals a mold that produces barrel-shaped airborne spores. Which organism is the most likely cause? Okay, so for this, it's kind of important to note the symptoms, obviously, so fever, cough, and malaise, and where the person is. So southwestern United States, so or sometimes they can throw in California there, right? The person has eosinophilia, so it should at least point you towards what kind of organism it is. It gave the shape, so the barrel shape of like airborne spores. So this is actually referred to as arthroconida. So arthroconida. All right. So here we're talking about coccidioides, right? Now, this tends to cause like a subacute pneumonia. So subacute pneumonia, right? And then you get the eosinophilia that comes with it. It causes a couple other things, right? But this is kind of the important part of it, all right? Now let's look at the other options. So blastomyces, these are usually around the Great Lakes. So Great Lakes, all right? And they have that broad-based budding, right? So if you see a question with broad-based budding yeast, right? Then they're referring to blastomyces, right? Histoplasma tends to be where you have like bat droppings, so bat droppings, right? So people that like going to caves tend to be susceptible to this, right? And if you see a question that mentions that they are intracellular in macrophages, then they might be hinting towards histoplasma. Nocardia is super important in immunocompromised patients, so immunocompromised patients, right? And that's where you end up with like the branching bacteria, right? It's one of the branching bacteria. Then strep pneumo, you all know this one, right? Is that be the gram-positive, lancet-shaped bacteria, all right? That causes pneumonia and a bunch of other things. Because remember the CMOPs, conjunctivitis, meningitis, otitis media, right? Pneumonia and sinusitis, all right? So great. See you in the next one.